Yep, so welcome everybody. Thank you for coming to join us this evening to hear from ACT Health about the update on the Northside hospital transition. Before we start this evening, I just wish to acknowledge the traditional custodians of the land on which we're meeting today, the Ngunnawal people, and I wish to acknowledge and respect their continuing culture and contribution they make to the life of this city, and I'd like to welcome any Aboriginal and Torres Strait Islander people joining us this evening. So my name's Anne-Marie Swoboda, I'm a GP and I'm the Medical Director of the GP Liaison Unit at Canberra Health Services. And this evening I have joining me Cathy O'Neill. Cathy is the Deputy Director General of the Northside Transition Services Continuity. Is that right, Cathy? That was a bit of a mouthful. Sprung that on me. This evening you're all going to be on mute and the video's off for the moment. If you do have questions along the way, please do put them in either the QA box in the or the chat box. You'll find the little three dots at the bottom corner, right-hand corner of your screen, and please pop all your questions in there as we go along, and Cathy and I will try to answer as much as we can. So Cathy, I'm going to hand over to you now, if you'd like to give your presentation.
Thanks, Anne-Marie, and good evening, everybody. Thank you for the opportunity to come and talk through some of these issues with you. I'm just going to run through a couple of slides just to make sure that we're sort of all on the same page. I know there's been a lot of varying views and quite a bit of misinformation already out in the public domain. But I won't talk for too long so that we can really spend the time listening to your questions and addressing those. So as Anne-Marie said, some of you will know me as the Chief Operating Officer from Canberra Health Services. I moved across in to head up this transition team. There are two of us working side by side. I'm heading up the service continuity stream, and Liz Loper is heading up the infrastructure, legal and commercial side. So of course we didn't test that my computer at work. There we go. So the government's been talking about the new Northside Hospital for many years now. It's been an element of the past two elections, and they have been funding some early design works for a couple of years. They have now undertaken extensive site feasibility studies, as well as what they call a block and stacking design process to work out how much land they need. And as a result of all of that, they have decided that the new Northside Hospital is best being built on the existing Calvary Public Hospital campus in Bruce. And that's for a number of reasons. There is enough land there. We know it can cater for a public hospital in terms of all of the infrastructure. It was important to also try to maintain those links with the private facilities that are on that campus. And if you have a look at the growth trajectory for the north of Canberra, there's actually three distinct areas of growth, the biggest of which is actually the inner north, with all of the high density development that's occurring there. Then you've also got out towards West Belconnen, and then also North Gungahlin, and Bruce is actually really in the centre of those three areas. The government's committed to spending more than $1 billion on this new hospital, which will be a significant capital investment for the government, and is one of the largest health infrastructure projects to be delivered in the history of the Territory. The new Northside Hospital will more than double the existing capacity at Calvary. It will provide more beds, increased services, the potential for centres of excellence, and a modern state-of-the-art hospital for patients, visitors and staff. Those of you that have been into Calvary recently will know that that building is 50 years old and is really towards the end of its useful life. It's had a condition assessment report done on it that flags the majority of the buildings really need either significant rework or demolishment. Sorry, just working out my... So in order for this to happen, the government has decided, after having negotiated with Calvary for over 18 months around how this could potentially happen, It's now decided that its only option was really to introduce some legislation, and that legislation was introduced last week, and it's known as the Health Infrastructure Enabling Bill, and it has essentially four purposes. The first of which is to acquire the land where Calvary Public Hospital is currently situated, and it is only the public hospital area. So those of you that know that campus, it's the land that sits within that Mary Potter circuit. So it will not be taking the land that the Calvary's private services, the clinic or Hyson Green currently sit on, and the territory will ensure that there is ongoing lease and appropriate access to those services. The Calvary Network Agreement, which is the contract that Calvary provides the services under, is actually tied to the lease of the land. And so by acquiring the land, that will bring the Calvary Network Agreement to an end. And the government has also decided that if they were going to invest if the government was going to invest that much money, they really needed it to be on land that they owned and a service that they controlled. And so they've made the decision that the service should be transitioned into government, and consequently the services will transition across under the management of Canberra Health Services when or if that legislation passes. The fourth purpose of that bill is to ensure all of this is done on just terms. The dates specified in the legislation, should it pass the Assembly on the 31st of May, when it will be debated in the Assembly, is for that acquisition to occur on Monday, the 3rd of July. So in managing the key priorities, there are three things that we're particularly focused on in the transition team. The first is around providing certainty, and that certainty to staff, but also to the community. It's to support the workforce and to provide ongoing access to safe and a positive patient experience. Sorry, I've lost control of that canal.
Let me check.
Let's see if that works. So there we go. So the benefits of a one provider model, and most of these benefits won't be realised in the short term, they're longer term benefits. But one of the things that anybody that has been working in ACT Health will understand is that having a contracted service provider in the public health system has meant some structural difficulties in terms of flexibility and agility. And we've seen this play out through COVID and even recently through the theatre fires in Calvary, and that's of no fault of Calvary. It's just that they're managing a contract, and in order for us to work with them to change any of their circumstances of service delivery, that's had to go through what has turned out to be quite lengthy, protracted negotiation around that contract. So having a single service provider will allow the government to be able to flex and be much more agile in service provision. It will allow for a stronger foundation to build and significantly grow that service capacity over the decades to come. It will enable us now to revisit some of the planning around the infrastructure requirements, both on the Canberra Hospital campus, but including the Northside, the new Northside Hospital, to ensure that we get the best outcomes of that infrastructure and make sure that we have the most appropriate services in the right place. It's expected that Canberra Hospital will remain the trauma and tertiary referral hospital. However, the new Northside Hospital now, we can think about what does it really need to do in terms of its specialisation. It's important that we make sure that Northside Hospital really is got some specialties that it can be rightfully proud of. It already does. Calvary does excel in some of its service provision. But This will allow us to revisit the whole concept of hub and spoke type approaches to service provision. And there'll be things where we want to have specialties at both sites. There'll be some things, particularly the subspecialties, where it'll only make sense for one site to provide those. But under this new planning approach, we can consider either site for that. It will allow us to load share much better than we are currently able to do, and we will be able to move towards single wait lists in both outpatients and surgical services. It will also provide staff mobility and opportunity, particularly in the training space. So the planned next steps, as you know, the legislation was introduced last week. The next sitting day is the 31st of May, which is when the legislation will be voted upon. And if that passes the Assembly, we'll then move into the formal transition process. And the legislation and the regulations that sit alongside that legislation compel both Calvary and the Territory to undertake a raft of activities during that transition period. And we'll be working very closely with Calvary to assist them through that process. On the 3rd of July, Monday the 3rd of July, Canberra Health Services will take over the management of the Northside Hospital, but it's our intent that very little will change in that initial period. Our primary objective will be around some stability, and we know that there is much that we won't be able to do in that transition period that we'll need to continue to work through post that. Later in the year, we will recommence the planning in earnest, both for the master plan at Canberra Health Services and also for the Northside Hospital, so that we can revisit the consultations that have already occurred and start to delve down into the next level of planning. And all of that will be done in consultation both with staff and community and stakeholders to make sure we end up with the best possible service options for the Territory. Throughout this period, we're expecting that there will be ongoing discussions with Calvary, particularly around the negotiation of those just terms. So what does this mean for people working at Calvary? Well, right now, we know that they're in shock. This has come out of the blue for many people, and we know that brings with it a range of emotions, and uncertainty and anxiety are particularly running high at the moment. CHS, as part of the transition team, are making sure we are providing information regularly, and we're updating it in some cases almost on an hourly basis as more information is known to us. We've completed 8 or 9 workforce support sessions already. We have a hotline available for workforce and key stakeholders. If they've got any questions or concerns, they can ring in. And we've got printed material available as well. There are several senior members that have been moved into the transition team, and all of us are available to meet with stakeholder groups if that's required. We're trying to make this as easy as possible, and certainly from my perspective, I'm working through great detail in all of our planned transition workflows to make sure this is as easy as possible for the staff, both for them personally as they transition employment, but also in terms of making sure we can continue seamless service delivery from that site. We've also negotiated with the government that we'll be able to pay each transitioning employee a flat allowance of $200, because we know that this is going to take time for them to actually transition their employment. We will also, when the time is right, work with the teams in Calvary. We're very conscious of the very proud history and the culture that Calvary has, and we want to work with those teams to work out how do we preserve and honour what it is that's been great about working at Calvary and the history it's had in Canberra's service delivery. Just got a slide here around transitioning employment, more just for your general information, knowing that all of us know somebody that works at Calvary. And just really wanting to highlight that there is a formal process that is in train. This won't formally commence until the legislation is passed, but we have invited Calvary employees to make themselves known to the transition team so that we can start to test that onboarding process and also answer any specific questions individuals have, particularly if they've got some special circumstances that surround their employment. But the principles that we're working through on all of this is that there is an intent to transition all employees. There is plenty of work available in the Territory. There is certainly not any job losses intended as a result of this transition. We aim as much as possible that those staff will continue to work in the same team, doing the same job that they're doing prior to the 3rd of July to the job that they will do post 3rd of July. The employees at Calvary Public that are employed under the Territory's enterprise agreements will be coming across on exactly the same conditions with all of their entitlements recognised. And wherever there has been any sort of interpretation difference between the way Calvary implements that EA and Canberra Health Services, we'll err to make sure it is in the employee's favour. There will be no application process, no interview process. However, we do need to undertake a process. It is part of employment law and it is part of the human rights of individuals. So we can't just do this as an administrative transition of employment. So in terms of impact to services, Calvary will still be governed by the Calvary Network Agreement up until that date of acquisition, and are required and have publicly committed to ensure that they continue to provide services right up until that date. We do know, however, that there will be a lot of uncertainty and anxiety, and we also know that we're embarking on the winter season, and so there may well be some disruptions to services, but we expect that that should be limited to those that would ordinarily occur in the course of their service delivery. So patients and indeed GPs should expect that services as planned will continue unless contacted directly by Calvary. Post-acquisition, so post the 3rd of July, as I've mentioned, we're aiming for a period of stability. There will be no significant change in any of the processes. Calvary will continue to operate their services the way they do today. Having said that, if there are staff in key positions that don't come across, we may be forced to make some decisions around how we support those services in the short term. But certainly there will be no wholesale change of any processes or any structural changes. So from your perspective, it'll be the same referral processes, the same booking processes, and you'll be dealing with the same team members. Just a couple of other things that is worth highlighting. The first is around Clare Holland House. Clare Holland doesn't actually form part of the Calvary Network Agreement, and the lease is a completely separate lease. In fact, the government owns that lease, and there is no current dedicated contract for the provision of those specialist palliative care services that operate out of Clare Holland. So the government has asked Calvary leadership to come back to the government on what they would like to do with Clare Holland in the first instance. Now, we know this is going to put a lot more uncertainty into the mix, but we are also very respectful of Calvary's role and national interest in providing specialist palliative care services. So we're hoping to negotiate our way through that, and as soon as we have more information available, we will certainly be communicating that to staff and stakeholders. If any of the GPs are working at Calvary Public, we would request that you make yourself known to the transition team so that we can make sure that we are catering to your transition requirements. There is a separate form for VMOs to complete, or if you're employed as a staff specialist, there is an employee form. Now, there's no compulsion to do that form. It's just that we are unsure of when and in what form we will be getting data from Calvary. We know that they have committed to working with us, but in the interests of time, the more we can know and start working on ahead of time, we are aiming to do that. Towards the latter part of this calendar year, we will start to bring teams together and start to undertake some planning and consultation regarding the single service provider model and how does that look, and are there any benefits in potentially amalgamating teams, or are those hospitals for that particular team big enough to have standalone teams? How do we actually bring that all together so that we are working at least seamlessly across the territory? And we'll also, the Northside infrastructure team will reconsider and confirm both the Northside, but also, as I mentioned, the Canberra Hospital Master Planning, and start to commence the detailed design for the actual Northside Hospital. And there will be plenty of opportunities for stakeholder involvement in those processes. So, as I said, I didn't want to spend too much time talking, so hopefully that's covered off some of that basic information for you. There is a website that has been established. We've got a dedicated email there that you're welcome to pass through any questions to us, and you're also welcome to call that hotline. We haven't done too much sort of scripting for those hotline callers in terms of clinical services or questions from the GPs, but feel free to call the hotline and register, and one of those hotline callers will make sure somebody with the information will get back to you to answer your queries. So, Anne-Marie, I'll stop sharing that now.
Fantastic. Thanks, Kathy. Thanks for that. That was really comprehensive presentation. We do have some questions coming up in the QA and chat function, so I'll just start asking you some of those, Kathy. There's a couple which are themed around mental health, particularly. So how will mental health services be coordinated with Canberra Health Services mental health programs?
So essentially no change. The psychiatrists that work at Calvary are actually CHS employees, and so there is already a reasonable degree of integration of mental health services across the campus. And as I've mentioned, there is no intent initially to make any service changes. But I think mental health is one of those exciting areas that the planning will really be able to tackle. We know the projections for mental health acute services are going to grow significantly with the growth of population in that north side. And so this will give us the opportunity to say, okay, what do we do with mental health services? Do we replicate services exactly as they are at TCH across on the Northside Hospital? Do we have either of those facilities subspecialise in some areas? So there will be a lot of discussion around that, and I think it's quite an exciting area for mental health.
And somebody else asked about time frame for changes and how this might impact on mental health services, but I think you've sort of really answered already that there should be no impact. Yeah.
No. And we really are very genuine about consultation. This won't be sort of a smoke and mirrors or a lip service type approach. We truly do want to particularly bring the teams together from both campuses and really have those facilitated conversations about what's best for the territory moving forward.
So the next question, Kathy, was about outsourced surgeries. So what will happen with outsourced surgeries, for example, ophthalmology, to private hospitals due to the destruction of the theatres?
It's our intent that all of those will continue. The government will continue to use both Calvary private hospitals as part of its outsourced elective surgery programs and joint replacement surgery. And we will honour any of those contracts that Calvary Public have put in place to stopgap their lack of capacity with the theatre fires. We will be working very hard to try to reinstate the theatres as quickly as possible on Calvary's campus, but we will certainly be making sure the throughput through those private contracts continue.
Okay. And the next one is about referrals. Will referrals to specialists be centralised across the two sites? And if so, will triaging also be done at a central point, allocating patients to either hospital?
No,
my heart and yours.
Yes, no change to start with, but I think it is necessary for the Territory to move towards a single outpatient waiting list as soon as possible to ensure that we've got much better equity of access, but we won't be addressing any of that until the latter part of this year.
Okay, so and then I guess that next part of the question is, so how does a GP decide whether to refer a patient to the Northside or to TCH? So nothing really should change initially.
No, and as soon as we, start to do any of that work, we'll be working closely through the GPLU's Capital Health Network and getting that comms out to GPs.
Yeah. And Kathy, just from a practical note, there's currently a Calvary smart form. So on the 3rd of July, when things transition, will it still be, what will it be called? Will everything just change name? How does it work?
Yes, so we expect this is all, pending the legislation passing and then working with Calvary, but we expect that Calvary will take all of their branding with them. And so we will have a process of going through and cleaning all of that up. We do have a working name for the hospital because we just need to, register the hospital in licenses and those sorts of things. So we'll be working through all of that, and that also includes things like provider numbers and prescriber numbers with Medicare. We've got a process to transition that ownership and location across.
Yeah. Okay. And the next thing was just really a comment, which is to say that if certain services are confined to one hospital or another, there needs to be a comprehensive guide, for GPs in the ACT to understand where those services are going to sit. And it's important to have collaboration with CHN on that. And we'll have to make sure that Health Pathways is all updated as well to reflect all of that.
Yes.
So time frame for changes, I think you really dealt with most of that in your presentation. So I think we'll pass on that one.
Although I might just add to that, Anne-Marie, I didn't mention it. So construction is expected to begin in 2025.
Yeah.
And so there's a lot of detailed planning that will need to occur prior to that. And it's expected that the new Northside Hospital will be fully operational by the end of this decade. And there is consideration to potentially building a couple of standalone buildings initially, so that we're not waiting for the full project to reach completion before we can do some expansion of services. One of the other advantages of the Calvary site is that we can actually build without having to demolish. There's enough land there for us to be able to build and continue to maintain services in the existing buildings.
Right. Okay. Yeah. So the next question was about, the drivers behind the decision and how long that idea has been going. I think you really covered that, but anything else you wanted to say around that?
No, I think I've covered that off. It has been a long process. I know Calvary is saying a lot about the fact that they had no idea this was coming. The government has been negotiating with Calvary Executive for at least 18 months, specifically on the location and approach to Northside Hospital.
Okay. What is ACT Health? Hang on. What is ACT Health have? What does ACT Health have planned? Can't quite understand this question. Oh, to support current workers at Calvary during the planned takeover transition, and how does ACT Health plan on stopping the current poor workplace culture from affecting those at Calvary?
Yes, all right. So the first part of that I think I've covered support of. We are really conscious about how staff are feeling. We know how we would feel if we're in their situation. There's a range of support and engagement functions underway and planned, and we will continue to respond to whatever is asked of us in that regard. As far as culture goes, there's a lot being played out in the media around culture, and all of us will have had our own experiences working with the various hospitals. We know that Canberra Health Services culture has improved significantly in the last 2 years. And in fact, the last culture survey results show considerable improvement. Calvary has also had its own troubles with culture as well. But what we do know is many people go to work in the organisation they work with because they want to work in those teams. CHS already runs 2 different hospitals. University of Canberra Hospital has a completely different feel to TCH, and we expect that we should be able to maintain that feeling that Calvary has. You know, it'll be important that you know, I think it's been described as being, you know, big enough to provide effective services, but small enough to care for its staff. And they're the sorts of things that we'll work with the Calvary team about. How do we honour that? How do we protect that so that, you know, that each of those campuses will continue to have their own, you know, subcultures.
Yeah, very good. All right, I think we're coming to the end of our questions. Does anybody else have any further questions for Kathy? Given it's quite a small group, if you want to raise your hand, we can unmute you to ask directly. And if you don't, in the next 5 seconds, I'm going to take that silence as bringing us to the end of this session. We've all worked a long day, so I'm sure we'll all be happy to have that time given back. Any last minute questions? Okay, Kathy, I think we're good. The questions. Thank you so much for doing the presentation. I think it was really good just to hear that. And, you know, it's good for the GP community to know what's going on. So thanks for offering that. And GPs out there, please, you know, Kathy's given those contact details. So if you do have further questions, you can contact Kathy and her team. And you can also contact either GP liaison at Canberra Health Services or the Calvary team as well. And we can always pass on any comments or questions to the appropriate people. So with that, I want to thank you all for coming this evening. Once again, thanks, Kathy, and thanks to Capital Health Network for facilitating this quick webinar. And good evening, everybody. See ya.
Good.